Due to the graphic nature of this program, viewer discretion is advised.
Get them on IV fluid.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.
Triage to front staff. What's going on?
The dog, owner said very lethargic at home. It's an intact female, just very down and out. She feels very warm.
Okay, is Sheila going down to get information from the owner?
Yep.
Okay, why don't you bring her over here? 1, 2, 3.
I'll grab a temp.
Let's get a heart rate and EKG going on her right away. Wow, Sheila looks bad, huh? What's going on, Sheila? Did you talk to the owner?
The owner said last night she started vomiting. She wasn't acting herself, and then today she was drinking lots and lots of water for the last couple of days. Yesterday she started vomiting. Today she's tried to go out and urinate, and the owner noticed a smell, and she just collapsed and hasn't gotten up.
And she's intact, right?
And she's intact, yep.
Okay.
And she just had a heat 2 months ago.
Oh, geez. All right. So she's probably, I mean, what are we thinking of? Probably a pile, right?
Yep.
For sure. I mean, that's one of our first thoughts. Can somebody get her shaved so we can do
Ultrasound?
ultrasound? Get an IV catheter, get fluid started, you guys. Sheila, can you get an IV catheter going? Her heart rate is really fast, so she looks like she's really sick. Can you help her get a... She's got huge distended uterine loops. Yep, she's a closed pile because she didn't have any discharge, is that correct?
No, Mom said she hadn't noticed any discharge.
Do you have any get a temperature on?
Yeah, 104.2.
She's really sick. We should get some blood work too. I'm gonna go and talk to the owner and make sure we have permission to do all this.
No, swap. Yeah.
Got it?
Yep.
Yep. So then heart rate of about 180 and lungs sound fine.
Good.
All right, just talked to the owner. This is a very important dog. This is a breeding dog, actually, so that's why she never got her spayed. And she wants to do everything possible, so let's get fluids going. And bolus a liter of fluids. Let's get a blood pressure on her. Get blood pressure going. And get her temperature down. Let's get antibiotics too.
sure you a spot here.
I talked to her about surgery already, so.
You can use that bag of fluids right there. You can start setting up surgery.
Can you start setting up surgery, Sarah? All right, we're going to give her 10 mLs of sulfasalin.
Here, I'll just set up surgery.
What?
No? Yeah, we probably need a piece of tape because of
Okay, so Mona's setting up surgery. I'm going to get sulfasalin IV, 10 mLs.
Milwaukee Emergency Center for Animals Television is brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, Metropolitan Fence, we're always on the level, and Camp Bow Wow, premier doggy day and overnight camps. And now, a word from our sponsors.
Welcome to Camp Bow Wow in Waukesha, the premier doggy day and overnight camp where a dog can be a dog. Our campers play all day in our 4 large indoor and 4 outdoor play yards. Watch your pup from anywhere in the world at our high-speed camper cams. Our certified camp counselors, spacious cabins with comfy cots, pup pools, and outdoor play equipment ensure that your pup has a great time. We're open 365 days per year for your convenience. Stop in for a tour and book a reservation for your dog's free day of camp. Visit campbowwow.com/Waukesha or call 262-547-WOOF for more information.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
The Humane Animal Welfare Society of Waukesha is so much more than a shelter. Our adoption staff, animal caregivers, and behavior department ensure the best possible adoptive companion. Our spay-neuter programs actively combat pet overpopulation in our area, and our animal rescue team safely returns lost pets back home. HAWS does one-on-one consultations, holds a variety of training classes and seminars, and even hosts camps for kids. Our shelter is and always has been open admissions and full service, providing resources for pets and their people for a happy lifetime together. HAWS, we're building a society that's humane.
Boarding, grooming, training, and more. When it comes to your pet, Animal Motel is their home away from home. At Animal Motel, we offer a top-of-the-line facility with boarding suites for both dogs and cats, outdoor play yards, a training hall, and so much more. Whether they're here for obedience training, grooming, or an extended stay, we promise your dog and cat will be part of our family. Animal Motel, personalized care for your precious pets.
Looking to get some training for your dog? For Pet's Sake is your one-stop dog training center. We offer all-inclusive obedience training, canine sports training, specialty classes, and more. We provide training classes in 3 convenient locations with our main facility in Maguanago, which boasts a fully matted 5,200 square foot training hall. While in Maguanago, check out our Bichon Buddy Rescue and take home your new pet. Bichon and Little Buddies Rescue takes in Bichons, other small dog breeds, and cats that need to be rehomed for various reasons.
Give over 10 minutes time. Here's the sulfasalin. Get a blood pressure on her and bolus a liter of fluids into her right away. And then I'm going to make sure that everything is, I get an estimate for the owners. This is going to be an expensive surgery, but we've got to get her into surgery as soon as we possibly can. Wow, she looks bad, huh? I'm really worried about her. Okay, we've got a blood pressure. Are you bolstering the leader into her? 60 blood pressure. Oh my goodness. Let's get hypertonic saline and head of starch, bolus. 3 ml per kilogram of hypertonic saline, and then 5 ml per kilogram of vet starch. What does her color look like?
She's pink.
Yeah, she is pink. She got her antibiotics, you guys, so I'm going to go talk to the owners and make sure that I get an estimate. No, you just... Okay, I talked to the owners. They want to do everything. They're good with the surgery. They're good with the estimate. This dog is very important to them. It's one of their main breeding dogs, but they know that they have to do what they have to do, and they have to get her spayed, so we got to get that uterus out as soon as we possibly can. Let's get her stabilized, her blood pressure to normal, and then they're getting set up for surgery, and then we'll get her right into surgery as soon as we can. So the owners are just filling out a CPR code status. They've decided they want to go full code. So if anything happens to her, we have to do everything possible. Yes, they want this dog. They want this dog, so it's very, very crucial to them. They don't care if she's spayed, they're going to keep her as a non-breeding dog. Get that uterus out, you guys. Get her opened up. So we're going to use the ligature on this so that we can get the uterus out fast. The ligature is an instrument that ties and cuts very quickly so that we can get the uterus out quickly because the dog is very unstable. So it's good for use in cases that are extremely unstable and very sick animals. So we can perform the surgery quickly and get the uterus out and get the dog back in ICU.
So what we did is we found our ovary, so we found our ovary on the right side. So right now what we're doing is we're getting our ligature together so we can clamp off the vessels that are connecting that ovary to all the rest of the vasculature, the aorta and all of that. Once we're able to clamp off on that, we can retract the ovary back, follow the rest of the enlarged uterus down, track it up the other side, so the left uterine horn, do the same thing on that side. Then what we'll do is we'll take all of that uterine tissue out, find the body of the uterus, and then be able to use our ligature with that as well. Clamp that off, pull everything out, make sure everything's nice and clean in there, lavage the abdomen, everything like that, and then hopefully close her up as quickly as possible. So the surgery went pretty well. We were able to get all the uterus out. When we have pyometras, we do worry about actually it rupturing and spilling out all the material that's in the uterus into the abdomen. So we try to work pretty quickly to get all of that out. So she's looking pretty good right now, and thankfully a lot of times if we can get this done as quickly as possible, get everything out, she hopefully will have a good chance at recovery.
I think now, especially in the next 5 years, the field is going to be 90% women. And I think it's going to change our field because men go into, a lot of times, into fields because they're thinking about pay and where is this going to bring them as far as their status goes. Women go into the field because they love, not that there isn't men that don't love animals, but our primary reason for going into veterinary medicine is we absolutely love the animals to the point of it's in our heart, mind, and soul. So it's a lot different, and I think the nurturing and the care of animals is going to change a lot because women are starting to own practices. I'm the first woman emergency and critical care specialist, owner of a hospital in our whole area, and there's not many of me owning referral hospitals in the United States. So the women owning the hospitals, you got the added touches. I think this is my personal opinion. You got that feeling that taking care of the client, the animal, making sure they're all laying on blankets, covered at night, you know, that type of nurturing feeling is going to change our whole veterinary medicine. This is Bruce. Bruce is a female. Most of the iguanas that I see over the years have lived 5 to 7 years.
She's about 17.
17 years old. Once in a while, like every 5 years, I'll see one at around 12. I've never seen one this old, and that's because he's got perfect husbandry. So it's really important that you keep their environment as close to their real environment, what it should be. And that's hard to do because we live in Wisconsin. So that's where the problem is. And it's an older iguana too. So like older people, a lot of people never had pneumonia in their whole life. Suddenly they become 80 years old, 90 years old, like this iguana would be in human years. Suddenly your chances of getting pneumonia are so much more. And it's the rainy weather, it's the change in weather, just like us. As soon as the weather changes, we get a little rain and you get this cold and people get colds and flus. So the same happens to iguanas. We think that that's what happened. The resistance was down, immunity was down, and he noticed some kind of breathing issues and then some blood coming out of the mouth. We had to get her warmed up, which we did here. We soaked her. By soaking them, they absorb through their cloaca, which is like their anal area in a human or a dog or cat, and they soak up water very efficiently that way. So we soaked her all night here, got her temperature up to about 100 degrees for 24 hours. And then we started her on antibiotics. So he's coming in today. The antibiotic shot is ceftazidime. It's a type of antibiotic that hits the respiratory tract because she has pneumonia on the x-rays, and that'll help with getting rid of the pneumonia. He'll give about, how many injections does he have, Chad?
We have 7 total injections.
7
about
total.
1 mil.
And it's every 3 days. So now he's coming in. We got the first one, which I'm sure she showed some improvement already, right? Would you say? A little bit?
Maybe a little bit.
Yeah. And then this is the 3rd day now, we're giving the 2nd injection. We're going to teach him how to do this. And then he'll give every 3 days at home. And then if you feel that she's not 100%, then you need to come call us and we'll give you more injections to take home with you. When you see the size of this girl, it looks like a small dinosaur, actually. Hey.
Yes, it's okay, baby. It's okay.
Get her.
It's okay.
And then the tail, too.
Put the tail in between my arms.
Okay. So what we're going to do is you're going to put the injection in the biceps or triceps, doesn't make any difference.
Okay.
And then the next one will go on the other side.
Okay.
So you're going to put it in about 1/4 of an inch into the muscle area and then shoot it in.
Okay.
So why don't you come over here?
Just put it in.
Yeah, perfect. Perfect. Oh, that was awesome. You did a good job. And then Chad will put her away. You want to help him. All right, perfect. That wasn't too bad. That was pretty easy, actually. Because she's about 10 pounds, so that's a pretty good size.
Lost some weight. I think
Has
she's
she really?
usually closer to 15 to 20
Oh,
typically. so-
really? Yeah, so her appetite went way down from the pneumonia.
Yeah, normally her stomach hangs pretty good.
Gotcha, yeah.
Because you love him completely, because he is part of your family. When your pet needs emergency care, you want the very best trauma and critical care specialist standing by. You know there's only one place you can trust and always count on.
I thank MECA and Dr. DACVECC for the medical care for Bailey.
Dr. Crescent and I are very happy that we were able to provide medical care for Bailey and all the other Milwaukee Brewer player pets.
At Metropolitan Fence, we have been keeping your children and pets safe in southeastern Wisconsin for over 27 years. We offer a full line of residential and commercial fencing, from vinyl, wood, ornamental, and chain link. For a free estimate, please call us at 262-547-6001 or visit us online at metrofence.biz. And remember, we are always on the level.
For over a decade, Fetch Magazine has examined the unique bond humans have with their canine companions by publishing popular dog-related topics. With a strong commitment to dogs in need, Fetch also prints local adoptables in each issue, supplies affordable advertising to businesses, and gives rescues 30% off of ads. This year, Fetch is offering $15 subscriptions for your convenience. For more information, visit www.fetchmag.com or pick up your free copy at a local pet establishment near you. Go Fetch!
This is Ecans. This is our little egg-eating snake. The owners adopted him about 2 weeks ago, and actually at adoption they noted this little swelling at the end of him. We did some radiographs on it, and it just looks like some soft tissue swelling. So we were hoping that it was going to be some food that he just hadn't kind of passed along through. But despite some soakings and some temperature changes, he still didn't really move it along. So the owners actually decided to let us go ahead and try to take it out surgically. Because he has no tissue to begin with.
Oh, because
he's so little that I could not tell you there's like a small casing on top of it.
Looks like
it has to be intestine, honestly, because there's nothing else in here.
Right.
So we just took out the mass right here and actually stuck a probe up the cloaca to figure out if that was in the GI tract or not. Thankfully, it was not. So we're thinking some other mass, possibly kidneys, possibly testes or ovarian, who knows. So right now we're just gonna close up really quickly. It's a very small suture because it's a very small little snake. And we're just gonna do a pattern that tries to evert the scales because reptiles like to heal in a way that closes in on the scales.
He here she is slowly waking up. Still under injectable anesthesia, and then of course the local was done and gas anesthesia we had during the surgery. So now we'll put him into the incubator, get him warmed up again.
He's a young snake, so hopefully he'll recover pretty quickly from this and do really well afterwards.
This is a Timna African Gray. Her name is Hannah. She's here today for a beak trim. She has a condition called scissor beak. As you can see, the beak, the top and the bottom do not match up. So she's going to be getting a trim of the beak. This is a chronic condition, and we are going to trim her beak and help to realign everything.
She's a pretty girl. Oh, she's a pretty girl. She's a pretty one. I'll grab it for me.
Yeah.
It's okay. You're okay.
That's better. No, it's really got to be on this side because it comes over this way.
Oh, so sorry, so sorry. Oh.
Oh, that's better.
Oh, I know.
Okay, we'll just give her a break now, so we're set.
Come on. Come on. There, Diaz.
Here we go. See, now it's lining up better. Oh, see, it's still singing out, so maybe we'll get a little more out of there. But it looks better.
Today's show was brought to you by HAWS, the Humane Animal Welfare Society of Waukesha County, leading the community in animal welfare and assuring sanctuary for animals in need. Metropolitan Fence, we're always on the level. And Camp Bow Wow, premier doggy day and overnight camps.